and welcome to Wellness Series with Lush, a platform where we get in touch with our well-being. I'm your host. My name is Lucia Malebazi. For the longest of time, every time we hear about emergency response, we're looking at somebody bleeding or somebody not breathing well, whereas there are other conditions that we need to be aware of that might need emergency response. Remember, those seconds count. In the world that we're living in right now during the COVID-19 pandemic, are we confident to be able to attend to an emergency? Do we even know how to attend to an emergency? I'm fortunate enough to be joined by Dr Fidelis Madondo from Med Rescue Botswana. He is the medical director there, who will be breaking it down for us to understand how to respond at home, at work, in a public place, alone. What are some of those skills, the knowledge that you need to know to make those seconds count? Good afternoon, Dr. Madondo. How are you?
Good afternoon. Thanks for inviting me.
Thank you for being here. I think it's very, very important, and I'm loving that we're having this platform to have Med Rescue Botswana and yourself to empower not just me, but the viewers as well on how to respond should something happen.
Very important.
And most importantly, because we're living in a deadly pandemic, if I can say so. A lot of us are anxious. We don't know what to do. Probably we're not even confident to attend to an emergency because we're thinking COVID-19. From your experience, just break it down for us. Bringing it home, what are some of the common emergency responses that we come across? Botswana.
Well, Botswana is not very different from the world over.
Mm-hmm.
And common emergencies happen everywhere.
Yes.
People can faint, people can get injured and bleed.
Mm-hmm.
Some people have conditions that are known like epilepsy, diabetes,
mm-hmm.
asthma, and so on.
Mm-hmm.
And these things can actually affect them anytime, anywhere.
Yeah.
And people who are close to them need to know what to do to assist them.
Yes.
But more importantly are things that are unexpected, like a child dropping into a swimming pool. You can pull them out and do you know what to do and things like that.
Mm-hmm.
So it is very important to understand what first aid is.
Yeah.
I'm sure everyone can understand that the definition is in the name itself. First aid, this is the help that is given before people are taken to a hospital, before an ambulance arrives, before a professional person takes over.
Mm-hmm.
So it is very important, COVID or no COVID, but more so in these times where COVID has sort of complicated issues.
Yes. Yes.
Yes.
So let's look at the fundamentals of first aid. You know, what does one need to look out for? So you have a patient who's just fainted or they've collapsed, or you basically maybe don't even know what's going on. What are some of the first things that one needs to check for?
I think it's very important to understand that we have a tagline which says when seconds count. If someone is in a dangerous situation, the people around need to offer help if the person is to survive.
Yeah.
We're looking at a person who is bleeding. Then the bleeding needs to be stopped.
Mm-hmm.
More importantly, people who have stopped breathing, whose heart have stopped, they need assistance called CPR, which basically stands for cardiopulmonary resuscitation. This is when you find people pressing on the chest, giving mouth-to-mouth breathing and so on. Those actions are very, very important and need to be taken within about 4 to 5 minutes if someone is to survive. If you don't take action when things like that happen, you pull out the child from a swimming pool and you just put the child there and wait for emergency response to come, you can actually lose the child.
Yeah.
You have a higher chance if you do something that helps the child. Therefore, we encourage people in all settings, at home, at work, in public places, to learn about first aid, where then they will be taught how to do CPR, which is what saves lives immediately after someone has collapsed or an emergency has come about.
Yeah, in most cases.
Yeah.
Let's zone into CPR because, like you said, you're pressing against the chest or on the chest at the same time trying to breathe air if that's the right expression,
Yeah.
into the patient. How do we approach that with COVID-19, living in this pandemic? Do we still, what should we look out for? Because I'm foreseeing a situation where somebody falls and people know what you need to press and then offer air or whatever, but what about COVID? How do you reassure the viewers at home how to do it during the COVID pandemic?
Thanks for that question. It's not only COVID, really. Any infectious disease can be frightening to the rescuer. So even if you have people who have learned how to do CPR, they may be very hesitant to give help in this time of the COVID pandemic. But if people have been trained, and I emphasize people who have been trained at first aid and CPR, there is what is called chest compressions only CPR. We know that COVID comes from your nose, comes from your mouth. Those secretions, if they enter someone's mouth or nose or eyes, then they get the infection.
Yeah.
Therefore, people would be very unwilling to do a mouth-to-mouth on a patient whose status they don't know.
Yes.
They may have COVID, they may not have COVID. And unfortunately, if someone has got COVID, you won't know until they are tested because they can be asymptomatic.
Yes, yes.
Therefore, there is what is called chest compressions only CPR. This is when people push on the chest to try and revive the heart. This is what people can do in this time of COVID. I wouldn't advise anybody to do a mouth-to-mouth resuscitation because of the times that we are going through.
Yeah.
Sometimes people use what we call a barrier device. It's a special plastic with a valve that you put in the mouth of the patient,
Okay.
so that you can blow into the patient's chest without getting any secretions back. But with COVID, because it's so transmissible,
Yeah.
that is not advisable. If someone stops breathing, they seem to have collapsed, the heart has stopped, they are not breathing, we advise that you do chest compressions only until professional help arrives.
Arrives to do
Yes.
that. Okay.
Yes.
And then of late, locally, we've seen a lot of kids drowning. We've had of cases, kids choking.
Yes.
What can you say to parents out there, or to child minders, in terms of what to look out for, what to do, and empowering them? I know that ultimately they need to seek proper training from an institution like yourself.
Correct.
But for now, those who are watching, how can you motivate them to actually take that step and seeing the need to empower themselves with first aid skills, especially in a home? I know it talks to everybody really, but now I want us to zone into a home setting.
That's an important question that you ask, because if you talk to healthcare professionals or parents for that matter and ask them where are their children during holidays, if they're not at school, they're at home with a maid,
Yeah.
who probably has no clue what to do if the child is burnt by fire, falls into a swimming pool.
Should I bring
or
a
falls into
scenario? What
fit.
will happen?
Yeah.
Okay, so you're right. They're not. Most of them are not empowered. The first thing they will do, the child is busy choking or respiratory distress or burning. She will be on the phone. She'll say, "Mom, the child is." And like we were talking earlier on, those seconds count. Those are the seconds that instead of calling mom to say,
Correct.
"This is what is happening," they could be doing something.
Correct.
Yeah.
So there are two aspects that we need to understand, and which I wish the viewers to really understand as well. One is calling for help, and number two is taking action. The person that you should call when there's an emergency is not the mother or father of the child. You should call emergency rescue services.
Yeah.
It doesn't matter who they are. Because if you phone the mother, they may be in a meeting with a silent phone. If they are not in a meeting, they're available. Their first instinct is to come to the child.
Yeah.
And in a traffic with no sirens and so on, they will take forever to get to you.
Yeah.
So I think people need to educate child carers or minders that if there is an emergency, they should give them the emergency number.
Yeah.
There are many numbers. There's the government ambulance, there are private ambulance services, MRI is 992, which is very important, because then the ambulance can come with the lights and sirens and get to the child earlier. rather than the parents trying to put on hazards and someone saying, how is he behaving? How is he behaving?
Yeah.
And they are blocking you and so on.
And then they get there as well, they don't have the skills.
Correct.
Yeah.
And there's a lot of time that is lost.
Yeah.
Then secondly, the maid or whoever is the childminder needs to understand basic first aid issues. Like if you've picked up someone who was in a swimming pool, they need to know how to do a mouth-to-mouth resuscitation, which can be life-saving. Because when somebody has fallen into the water, the problem is their breathing system has stopped, their airway has been blocked and so on. So when you get them out, you need to do mouth-to-mouth breathing. So basically, first aid becomes very important for people who are caring for your children. I had a very bad experience in Zim some years back. A very professional doctor. His child fell in the swimming pool, and the maid was busy looking for the doctor. The doctor eventually came, but after a struggle with traffic and he was busy and so on, and the child passed away. And these are professional people who are looking after other people's children, but theirs are with a person who has no clue what to do in an emergency. So I think it's very important. And I must add that at MRI we give trainings for everyone, whether these are childminders, professionals, office workers, and so on. So in my assessment, it is very important for everyone, if we can, to learn some form of first aid.
Basic first aid.
That will save life.
I think that should really be I almost said prerequisite, but that should be an empowerment that we all have, or we need to have actually in our lives, especially during the times that we are living in.
Correct.
I heard you mentioning mouth to mouth in a scenario of a drowning or drowned child. How safe is that in the COVID? Because I'm seeing that view. I was saying, did you say mouth to mouth?
Yeah, that's true. Under normal circumstances, when people train first aid, they are then given a barrier device that they can use to do the mouth to mouth. And this is useful for people that you don't know. But if you've got loved ones that you live with in your house, it's your spouse, it's your child, it's your mom, or even mother-in-law, you may have to do mouth to mouth. If you know people and the risk of disease is less, you can actually do mouth to mouth without any barrier device. But in the case of COVID that we have right now, it's unpredictable. It becomes very difficult. It depends on how close, how well you know the people that are in trouble. But like I said at the beginning, if you cannot do mouth to mouth, you can do chest compressions only. Resuscitation, while the emergency response people are coming.
That's very, very important. And in wrapping up, Dr. Fidelis, what message? I want a very punchy, impactful message from you as an expert in this. What can you say to our viewers at home, bearing in mind that we have parents, we have childminders, we have daycare centers, we have business locations. I mean, there are emergencies as well in offices and in business centers. What can you say to them in regards to emergency response, especially in the times that we're living in right now?
Thank you for that question. There are a number of aspects that we need to bring to the fore here. There is the issue of training, which is very important. In certain organizations, it's a regulatory requirement that you should have a minimum number of first aiders. And people who look after such areas and who send their employees for training understand the value of first aid. But these are the same people who leave their children with an untrained person, your childminder. So I think what applies at work, if you're worried about the employees at work, you should also be worried about your family. So training is for everyone. If you do it for regulatory purposes at work, why shouldn't you do it for your own family?
Safety.
Exactly. And why shouldn't you do it yourself, so that you know if there are problems that arise either in a public place or at home, then you should be able to act. But then again, I think we mentioned that you should know who to call when you have an emergency. People who are looking after your children or employees at an organization, they should know who to call when they have an emergency. The right people to call when there's a life-threatening emergency are the emergency response people, the ambulance people. They will bring the hospital to the patient. They will bring their gadgets, they will bring their skills. So all they need is the time to get from where they are best to the patient. Whereas if you are driving from your workplace, getting home, getting into the vehicle, taking your child home, it will take forever. So it's important for people to know who to call. If there's a fire, we call the fire brigade. If there's a robbery, you call the police. If you have got a medical emergency, call the emergency response people. Yes.
We need to have those in our contacts list as actually, so that you just press that number and it goes through. We need to know those numbers. I usually say have them written maybe where it's visible at home, so that everybody can know. For ambulances, there's, for fires, that for you know that for med rescue is 992. Dial that number as soon as possible, so that you get the response. I know that growing up, we know that for government emergency services, we have the 997 and the 999. Those are the numbers that we need to know, because like med rescue says, those seconds, what you say, the seconds
when
count.
Seconds count.
Yes. And we need to make those seconds count. Thank you very much, Dr. Fidelis, for joining us. I warmly appreciate. I know this was just the tip of the iceberg, and I'm hoping that we will have more way. You will actually show us when you say that mouth to mouth. This is what I know you guys have those nice dollies that they use for training. So you actually show us what it is, so that the viewers can appreciate that when we say mouth to mouth, what do we exactly mean? When we say chest compression, what exactly do we mean? So I'm really hoping that we can have more of these ones as we go on. But for now, thank you very much for joining us.
Just as a parting shot, in this day of COVID, what we have added to our first aid is COVID awareness. What is COVID? How do you prevent it? If someone is positive, what do you do at home? When do you take them to the hospital and so on? It's all encompassed in our courses that we are giving now. It's very important. So you do first aid, you're going to learn about COVID as well.
Which is important, because that is what we are living in right now.
Correct.
All right.
Thank you.
Well, we had Med Rescue Botswana with us, and I must say I feel very, very empowered with the little bit that Dr. Fidelis shared with us, and I hope that it has added value as well to you at home, at the office, if you're watching from your phone, walking around the mall, anything can happen anywhere, and remember those seconds count. From me, Lush, join me again next week for another episode of Wellness Series with Lush.